Well, therapists use a lot of words that we assume the rest of the world understands, and our parents, and oftentimes we forget that they don't. So I was reviewing some of the verbiage we use and decided that I want to do a quick video on what a modality is, because you'll hear your therapist use modality. Modality in healthcare can be a piece of equipment, it could be a form of treatment, it could be an intervention strategy. So it's a very generic term that we use to encompass many things. But I'm going to give you an example of some modalities that might be used. For example, physical therapy might use hot pack, ultrasound, massage. Those are modalities. We use kinesiotaping, which is in this cabinet. That is a treatment modality. We have several therapists that are trained in sensory integration and trained in neurodevelopmental technique, or NDT. Those are modalities that are being provided. Interactive metronome that we have here, which you've seen many times, is a modality. Here we have the cranial bed. Craniosacral therapy is a modality. Also, our lovely listening programs that we've been talking about with the bone conduction units, that's another modality. So we have multiple modalities that we work with all the time by discipline. One for speech therapy, because I didn't bring that up, is Vital Stem. We use that with some of our feeding kids, SOS feeding. Those are all treatment modalities. Many of the modalities that we use, and we use multiple modalities here, our therapists have actually gone to specific training to learn that modality and become certified after they've become a therapist. So one thing that families don't understand is therapists coming out of school are all at a level playing field pretty much, okay? But once they start treating, depending on where they're working and how much training and continuing education is emphasized, therapists will grow at different rates, okay? So if you're with a facility that it has a lot of modalities and investing a lot in continuing education, you're going to have a higher caliber, higher trained clinician. So these are important things to look at. That's why we try to list and update our bios all the time, so you guys know which modalities and which specializations we're able to offer. So another great modality we have is aquatics. Answers the question on my modality so you better understand, and you can be a better detective when selecting where you're going to go for treatment.